Hello, everyone. Welcome to Men's Health Week. Today we've got a little topic on testicular cancer. I'm joined here by Tom. Tom, do you want to introduce yourself?
Absolutely. So my name's Tom. You probably have seen me around or had a medical before with me, but I am the physiologist for SMB And yeah, as Derek said, we're going to be going through testicular cancer today. A few bits and pieces on how to kind of test for it and what are the symptoms and sort of shows, signs that you should be looking for, to make sure that you're staying ahead of your health.
Absolutely. So what is testicular cancer, Tom?
So, I mean, a lot of people would have known a lot about this anyway, so I won't go into too much detail. But your testicular cancer is cancer of your testes. So, 95% of testicular tumors are germ cell tumors. The germ cells are types of cells that the body uses to help actually create sperm. Got a few little stats there as well, but essentially you can either have malignant or cancerous, so benign or malignant tumors within the testes. So your malignant is something that is hazardous and also cancerous to your body, but the benign is usually when something is just a benign tumor, which is essentially non-cancerous.
Yeah, we've got some links in the next couple of pages which sort of explain the seminomas and the non-seminomas as well. So hopefully that could help out some people who want some more information. So how common is this, Tom?
Well, surprisingly, it actually isn't that common. Testicular cancer, as you can see, the first line there is relatively uncommon, accounting for about 1% of all cancers that occur in men. So each year, around in the UK, around 2,090 men are diagnosed with testicular cancer, which is a Cancer Research UK number, and it is unusual compared to the other cancers because it does tend to affect younger men between the ages of 15 and 44. So if you are between those ages, doesn't mean that you have it. It just means that you are at higher risk of developing it. Usually older, it sort of goes more into the prostate cancer than the testicular cancer. But fear not, because we are going to go through all the bits and pieces that you can do yourself at home to really make sure that you're staying on top of this, and it's something that you'll be able to do regularly, not just one off, which is good to
So
know.
really grown up question here, Tom. What actually are the testes for?
So testes are for reproduction. So we use them for obviously creating semen, and that is essentially used within the reproduction. Other than that, there isn't massive other uses for it other than the fact that it does produce our hormones. So when you get that testosterone, does your testes do produce your hormones that do kind of release from your body, which is really kind of how the men have their kind of sort of certain characteristics, you could say, allows men to develop certain aspects of the body, such as growing muscles, or bigger muscles, shall I say. Testes, or sorry, the testes or testicles are, as it says at the first line there, two small oval shaped, which are essentially covered with a sac within the scrotum. And yeah, I mean, other than that, they're used for reproduction. They're used for the hormone testosterone, and have a little. If you want to have a little laugh as well as a little bit of an educational video, I'd highly recommend you watch that video right at the bottom. And the Aztec word for testicles is actually avocado. So have a little look at that video when you can.
And that's explained in the video there. It's actually from the Oprah Winfrey Network, and it's got one of the doctors, Dr. Phil, I think it is, and he goes through and really interesting facts there. If you've got time to jump onto that, have a look. Although it is fairly small risk, Tom, what can increase your risk of testicular cancer?
Absolutely. So I mean, the first one there sort of talks about your ethnicity or your race. It does to an extent. It's a lot higher risk in white men than it is in black men. So that's your first sort of sign, if you like, or your risk factors. Your family history, can be sort of more predisposed to that through your hereditary. You can be a lot more high risk due to family history of testicular cancer. Being born with undescending testicles, so when one is slightly longer than the other, or there's some form of abnormality within the testes. So that could be absolutely anything enlarged. It could be a smaller size. It could be lumps or anything like that you can find. But that is usually at birth. You can sort of understand that one there. And infertility. Go on.
Yeah, sorry, Tom. Is that where it's potentially still in the abdomen, where it hasn't sort of dropped into the scrotum?
Developed. It can be that. I mean, the abnormality aspect here, it can be absolutely anything. It's quite a wide range. So it doesn't necessarily have to be that it hasn't quite dropped yet. It could be that it has dropped, but there's either dropped late, or it's it could be absolutely anything. It's usually, again, during puberty can be those kind of telltale signs as well. So as we sort of mentioned before, it is a lot higher likelihood to be in that sort of 15 to 44 age range. So usually just as puberty kind of sort of starts, it's kind of between there and about 44. So it's kind of any abnormality, really, anything that you can find that is different or has changed from birth or from a young age, moving up into your 44s kind of age. But that does not necessarily say that if you are over 44, you're not at risk of getting it. This can happen to absolutely anybody. So these signs that we're going to sort of tell you to look out for in a second definitely should be done by absolutely every man, period. And as we mentioned, sort of on the last little note there, infertility, people who are infertile are 3 times more likely to develop testicular cancer than fertile men. So if you are aware that you are infertile, then I would, again, definitely make sure you're keeping tabs on this and making sure that nothing's gone wrong.
Absolutely. So what else can increase your risk?
Wonderful. So smoking, one of the major ones is smoking, actually, more so on long-term smokers, but they're twice as likely to develop testicular cancer than non-smokers. If you are a smoker and a long-term smoker, and you do want to make sure that you're kind of reducing your risk as much as possible, we have released some guidance on stop smoking and the videos that have been released already. So please sort of go over and have a little look if you're looking to sort of stop smoking. Again, likewise, if you do need to speak to anybody, either your GP or one of us, our slot here, please feel free to speak to us where we can help. HIV and AIDS also. So if you do suffer from any of these, they do say that there is an increased risk of testicular cancer. And height, believe it or not. So a study was carried out in 2008, which basically found that a man's height affects his chances of developing testicular cancer. So a bit of a weird one there.
It's amazing, isn't it?
Yeah, absolutely. So many different things that can affect it. But I mean, the biggest sign, which we're going to go into in a second, is that you're making sure you're going through the steps to understand whether you are or not at risk of this cancer. So symptoms, early signs, which usually are very, very easy and obvious to spot. A hard lump on the front or side of the testicle. We're going to go into how you can basically sort of notice this in a second. But yeah, any kind of lumps you can feel, any swelling or enlargements, as that kind of goes back to any of the abnormalities that you find. If you do see any enlargement or shrinking of anything down there, any increase in firmness, if it becomes softer or firm, another way of sort of telling, any pain or discomfort, any pain when you're passing urine, anything like that is definitely cause for going to get yourself checked out. And unusual difference between one testicle to the other. So it could be weight, it could be size, it could be firmness, absolutely anything. But make sure you're checking both, which we're going to go on to now. Just how to check, we say that there's a lump to check for lumps on the testicles, but how do you actually check that, right? So from puberty, all men should be doing these regular checks. Best time to do it is in the shower or in the bath, or definitely soon afterwards. I believe this is because of if it's a warm bath or a warm shower, your body and your skin likes to vasodilate, and the blood sort of starts to flow towards the outside of the body. Everything kind of relaxes, and it allows you to really kind of get a feel, as opposed to being small, being cold, and usually your testes are a lot smaller during this time as well. So hold the scrotum in the palm of your hands, feel the size and weight of the testicle is the first one, and then about the sizes and whether you can feel if one hangs lower than the other. So they're the first kind of signs that you should be checking for. And the next one, please, Derek. So this is how you kind of feel the lumps or any the sort of bumps you can feel on your testicles. So feel each side, and essentially all you want to be doing is rolling your testicles between your finger and your thumb. You can kind of use your other hand to sort of help kind of lance it up a little bit and just make it a little bit easier, because it can be a bit of a challenge if it just keeps sort of sliding around and you can't really feel properly. So definitely make sure you're nice and secure, and then just really smoothly, just with your finger and thumb, just rubbing all the way around, just to make sure that you can sort of feel the whole circumference of the testy, and that is where you're going to be finding any lumps. If you do find any lumps, we'll go on to what you can kind of be doing from here, from thereafter, but that's essentially what you want to do. Really, really, really simple. It will take you no longer than about 30 seconds. And it's something that if you can get into a habit of doing, after you come out of the shower every day or bath, what's 30 seconds when you're talking about your life, So, and anything unusual, as it says, you basically just speak to your GP. We'll go through some personal stories in a second, actually, as well.
Yeah, I guess you get to know your body,
Yeah, absolutely.
and you sort of, when you're testing yourself, you could feel any abnormalities, and obviously that's it's really important, as it says there, to go and see a GP, because ultimately that could be the GP telling you it's nothing to worry about, or actually let's go and have an ultrasound or anything on there. So
Yeah.
I've got a couple of YouTube videos here for some advice. One's 4 minutes long, and it gives you an idea of what's what, how to, and stuff like that. There's also a UCLA video which is slightly longer at 33 minutes, but it gives you a breakdown of everything involved, and probably stuff not to worry about as well. Lastly, the last link here, I've actually taken this off the breakfast TV show Lorraine, and it actually shows the male scrotum live on telly, and what the guy is actually doing. Obviously, the penis is held under a cloth, but the guy is actually showing you how to test or examine yourself on TV. So I think it's really important that if you can watch it, obviously. But it's not something that you should just snigger at. This is really interesting and important information. So if you've got a chance, it's there. Again, it's 3 or 4 minutes long, but it's definitely worth checking out if you've got something to worry about or you're unsure.
Yeah, absolutely.
Now we've got a short video, and you'll have to tell me, Tom, if it's not working.
You're born into this world with a pair of best friends. They stick with you from the very beginning until the end. Whatever happens, they're by your side, just hanging in there waiting. But modern lifestyle consumes your time and energy, so sometimes you forget about them. Luckily, life has a subtle way of reminding you. Now we have your attention. Let's talk testicles. Get reintroduced to your buddies, checking them once a month. You can do it while you're in the shower or right afterward. Most signs of testicular cancer are found by men themselves or their partners, not necessarily by their doctors. Now it's time to take a hands-on approach. Hello. And hello. Here's how to do a self-check of your testicles. Use both hands to examine one testicle at a time. Place your index and middle finger underneath the scrotum and thumb on top. Gently but firmly roll the testicle between index and thumb. It's normal to have one ball slightly bigger or hanging slightly lower than the other. That's why you should get to know what's normal for you and look for changes. Not every lump is cancerous, but it is better to be safe than sorry. Symptoms of testicular cancer include enlargement of a testicle, any type of lump, even if it's painless, a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, back pain, or tenderness of the upper chest. If you have any of these symptoms, don't panic. Call your doctor. Ah! Now you know what to do. Help us tell others. A simple monthly blood check will give you the best chance of beating it, should it ever happen to you. In the UK, over 2,000 men are diagnosed with testicular cancer each year. That's around 6 men every day. It can develop in males of any age, but is the most common cancer of men aged 15 to 49. However, the good news is, testicular cancer survival is improving and has continued to rise in the last 40 years. If detected early, over 96% of men diagnosed with testicular cancer are cured. Know your body. Check your balls. Cojones Scotland, tackling male cancer awareness.
Wonderful. Yeah, great little video there, to be honest. Really kind of just shows you, exactly what you need to be doing and how simple it actually is to, to really kind of just test every day. There are several different ways that you can diagnose. I mean, they're not going to be self-diagnosis, but it will be once you do initially find some form of abnormality and you speak to your GP, you will either have some form of ultrasound. Doesn't hurt at all, quite literally what pregnant women have when they sort of have a look at the baby. They do the same thing, but they have a little look inside your testicles and just have a little look and see whether you've found any abnormalities, to see whether there is anything significant within them. Blood tests can detect certain hormones or elevated testosterone in the body, and the final way, which is basically a biopsy, where they take a small sample of that lump or whatever it might be, just to test whether it is cancerous or not. As we said, whether it's either malignant or benign. So those are the main ways that you will diagnose yourself. Well, you will get diagnosed, shall I say. A little sort of personal story, if you like. Well, probably about 3 years ago, I actually found a small lump on my testicles. Quite simply went to the GP. They quite literally just referred me straight to the hospital. Went straight in, had an ultrasound. Results came back, and they just said, no, it's just a little cyst, nothing to worry about. But it was as simple as finding a little lump, saying, that's not right, going down to the doctors, and this all happened in about a week. Really quick, but at least that gets completely ruled out. So definitely something I would recommend. So on to the next slide, please, Dave. I think we're nearly to the end.
It's about treatment now.
Yeah. So There are a few different treatments which are more common. So things like the chemotherapy and radiotherapy, if they are malignant, so if it is a cancerous cell, then they will use things like chemotherapy and radiotherapy. You can have lymph node surgery, which is usually just above or just below the abdomen's area. And you can also have testosterone replacement therapy as well. Now, more serious is if you do nothing about it, and sometimes they will have to remove the whole testicle. Usually, it's only one. It's not usually both. But those are the more common ones. But obviously, as we say, we don't really want things to get worse. You to be ignoring things, and your result is that you have to have a whole testicle removed. So avoid those kind of treatments here, and make sure you're checking as much as possible.
And it's probably important to point out that tests and studies show that even if you do have one testicle removed, your body still, or I guess the other one overcompensates for being the only one there, and your body still functions the way it does. You can still father children. You can still have hormones in. So yeah, excellent.
Absolutely.
So what facts have we got about testicular cancer, Tom?
So a couple of facts here. So it is extremely rare. So you probably sort of won't know anybody, if not only maybe one or two people. It is a very rare form of male cancer. It is most common in young men, as we mentioned, just after sort of hitting puberty, around that 15 up to 20, 30, and then again up to about 40, as it said in the video, 49, but between 44 and 49. It affects about 2,000 men each year, just over actually. Simple, effective and regular self-checking and awareness can catch it early, which is really, 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 really important. We can't stress enough. And 96 of all testicular lumps are benign, which is what we said earlier. Benign is just some form of cyst or lump. It doesn't necessarily mean that it is cancerous, but most times you will find that they are just cysts or some form of benign lump. So making sure you're checking, and even if it is benign, at least you've got that peace of mind as well.
Yeah, and some of them links I showed earlier on, they give an example of how the cyst is formed and what the cyst is, and most of the time it's just fluid. So really interesting facts if you've got time to go through them. Obviously, we're not going to do that now, but they're on the screen if you've got time. Anything else, Tom?
I think we're basically at the end now. What have we got for the next slide? Was that the last one?
That's it.
That's the last one, isn't it? Yeah. No, that's pretty much it. As I said, I've been through it. I've been through the experience. It's not painful at all. You just get yourself checked out, nice and simple. But it is definitely life-saving. You've got to make sure that you are definitely keeping a check on top of this. And if you are concerned, or if you are don't even maybe have just a slight inkling or something doesn't feel right, as they mentioned as well, any pains in the chest or the abdomen, just go get checked. It is you're not going to lose anything about by doing it. So absolutely. It's a win-win in our eyes anyway.
Yeah. So what we're trying to promote here, is that whilst it is very low risk as such, but for the amount of people, 2,000 people a year, compared to 33 million men in the UK, it's really small. But obviously it does happen, and if caught early enough, 96% of people, it's benign. So when you look at it, it is minute. But what we're trying to promote is that you go and see your GP. Take some time to look at these videos to get a better understanding, and yeah, don't be ashamed, don't be scared, just go and see your GP. Thanks everyone.